Melissa, we have 15 people. Let me know when.
We are live.
We're live.
Okay, thank you so much. Good afternoon, everyone. Welcome to the Health and Government Operations Committee. I'm going to read a couple of guidelines for our committee. Please do not forward the Zoom link for the hearings. Staff will not allow anyone who was not invited to testify into the hearing. I ask you to encourage people to watch the hearing on YouTube. Bill sponsor witness timing. The bill sponsor or a designee is allotted 5 minutes to present the bill. 5 witnesses will each be allowed to speak for 2 minutes in support. Please stay in the hearing until the delegates have had an opportunity to ask you questions. Next 5 witnesses will each be allowed to speak for 2 minutes in opposition and then respond to witnesses. Please conclude your remarks when you hear the timer ring. Members must remain present with your video camera on during the entirety of the hearing. Members, please ask only one question of the witness. If you have other questions, you may follow up offline. Please use the raise hand function to indicate that you have a question. So we have today just one bill, and the bill is Senate Bill 96. Senator McCray, will you be so kind? Good afternoon and welcome to, oh, 1 second. I think it's sponsor only.
Yes,
Go ahead,
I wanted to say that we've changed the rules and apparently we haven't updated them on the website. So I apologize for that. I didn't really want to interrupt you, but
Okay.
it's sponsor only.
Yes.
So all of those rules can just not be announced anymore.
That sounds
Okay.
wonderful. So sponsor only, nice and easy. Thank you, Chairman.
Thank you.
So Senator McCray, we are all yours for today. You're the only—
For 5 minutes.
For 5 minutes, you know, we are the only hearing we have today. So welcome to our wonderful committee.
Thank you, Madam Chair. Thank you, Madam Vice Chair. And I do not believe that I'll be the entire 5 minutes. I just wanted to say thank you for your indulgence. For the record, I'm Corey McCray, Senator for the 45th Legislative District. I come to you today on behalf of Senate Bill 96. What Senate Bill 96 does is that it asks for our behavioral health organizations when they are going to get their licensure, just to submit the community relations plan that's already in their accreditation when they go to get their accreditation, their credentials from that standpoint. Before I dig any deeper, I think that it is more than appropriate to thank Vice Chair Pina Melnick. Because of her help, I was able to not only work out with the agency concerns that may have been there last year, but also being able to work with the behavioral health organization coalitions to make sure that we can get a product that was approved by all, I should say. I don't think that I needed any more time, Madam Vice Chair, but if there's any questions, I will take the indulgence of the community. I mean, the committee, I said community, but committee there. So I did it in 1 minute and 5.
Thank you so much. We appreciate it. And I know that we have worked on this in the interim. Thank you so much for following up, you know, with the right people, because this committee, you know, under the leadership of the chairman, we like to make sure that everyone knows what's going on, that people are on board. So we're very grateful to you. We do have some questions. And the first question you have, Senator, is from Delegate Rosenberg.
Senator McCray, welcome to the committee.
Thank you, Delegate Rosenberg.
I assume that those conversations you had that you referred to have addressed whatever concerns there might have been regarding the fair housing law. Is that correct?
You said Maryland Fair Housing Law?
Yes. There are issues with regard to having facilities for people with disabilities, zoning, and you can't violate the federal fair housing law. I'm assuming that you worked out.
I'm not sure if we're talking about the same thing, Delegate Rosenberg, but what this bill does, it deals with behavioral health organizations. And what we did was we made sure that we included in this bill that it was all behavioral health organizations so that we wasn't violating ADA compliance. It was, we did that last year in reference to getting something from the AG's office to make sure that we were inclusive of all, not just some organizations. So this is behavioral health as a whole. But what they do, Delegate Rosenberg, they actually have community relations plans that are already established when they go to get their accreditation, I should say. The accreditation is an independent agency. It's not like the state is accrediting. We do the licensure part. So all we're saying is that the community relations plan that you already submit for your accreditation, that's also submitted from the licensure standpoint so that folks can understand the agreement that they had with the accreditation organization in reference to the community, that we have knowledge of what that agreement was. Because at this moment we don't, unless they submitted that to us themselves.
Okay,
So the
thank you.
bill, Delegate Rosenberg, is different from last year's bill.
I understand.
Okay.
you.
Thank you. Thank you, Delegate Rosenberg. Next, we have Delegate Lewis. You're muted, Delegate Lewis.
There we go. Thank you so much. Thank you so much. It's a pleasure to see you, Senator McCray. Thank you for bringing this bill. I want to make sure that I understand it, because I think what you've done is find a solution for communities like you and I represent that have multiple residential, behavioral health, mental health, and substance abuse treatment services offered in residential contexts. Is that right? So, and I just so appreciate your leadership on this issue. I think you and I agree, we appreciate services being offered, but we do want to always make sure that these organizations are good neighbors. So let me make sure I understand. Does your bill make publicly accessible the community standards that, relations that these organizations will commit to? Will neighborhood associations, for example, now have access to those agreements? They will.
That is the goal. Yep, you're absolutely right in reference to outpatient and inpatient. So both outpatient and inpatient. So that does have a residential component, because that is behavioral health does have that component. But yes, the state was saying that they didn't have access to it, but it creates a more transparent way in reference to the agreement that the organizations stated that they will be dealing with the community.
Right. And so now a neighborhood association can turn to that community standards agreement that and say, this, you promised to be a good neighbor in this ways, you committed to that in your accreditation. Now we as a community, we were going to hold you to that because we can see what you promised.
You're absolutely right. We do it with most things that come into our neighborhood. Some of them are community MOUs that may be established or things of that, but folks have a certain level of standard when they're operating within the neighborhoods. Yes.
Thank you so much. Thank you, Madam Chair.
My pleasure. Are there any other questions for the senator regarding this bill? 1 second, let me make sure I look at everyone's name. Seeing none. Thank you so much, Senator, for your testimony today. And this actually concludes our pleasure. It concludes the bill hearing on Senate Bill 96. Before you go, let me ask the chairman if she has any announcements.
I will see you at 2 o'clock for the vote session. And that's it. Thank you.
Thank you so much.